calling these variety store style treatment centers, and it is a big concern. City of London is doing something similar, and now it's something we're looking at in Windsor. And what is happening on the streets of Windsor that this is causing huge issues when it comes to people that are addicted?
Yeah, Dr. Tariq El-Sayek, he's a physician and owner of Hope Recovery. He is joining us this morning. Good morning, Dr. T.
Good morning.
All right.
How's it going, guys?
So we're good. We're good. You work, in our shelters as a doctor. You are seeing this issue up close and personal. And what is it that you're seeing? Like, can you explain to us what the issue is here?
Yeah, absolutely. So I think there's a misconception about what's going on in addiction treatment, especially as of recent with the sheer volume of news and articles and things coming out. What we're seeing is a big issue with a particular style of harm reduction, and that's called the safe supply mechanism of treatment, which in theory is a great practice, but ultimately what we're seeing is an increase of diversion and more drugs being available in the wrong hands of vulnerable individuals.
So are these drugs being prescribed to patients from certain pharmacies, and then they're just going out on the streets, and then the person can do whatever they want with those drugs, whether they want to use them themselves or trade them for other drugs?
Exactly so. So what, as I said, in theory, the idea is good. We can't necessarily control a specific patient's use habits. We might as well make it safer by providing the medications for them to use, because then we can ensure that these things aren't laced with other adult drugs. But in the case of what's happening with Safe Supply is the clinics that are essentially prescribing them are typically virtual-based, because there's no in-person addiction physician, let's say in Windsor or in any of the other bigger cities that are experiencing this, that are willing to prescribe the sheer volume of prescribed medications. And typically how this goes is you would observe one of the 4-say tablets, and then you would take a take-home supply. And I work very closely with patients in a variety of clinical settings, and I'm honestly being told that they're not really taking the medications and instead selling this for more higher potency street fentanyl. So instead of solving the problem, we are in a sense making the population vulnerable and not really changing the use behavior.
Yeah. As you were saying, Dr. T, obviously there's a reason that the safe supply treatment started and why it is in place. But what do you think would be more effective? Is there a way to combat this issue?
I think it needs to be standardized. We need to get the anchored community partners. We need to get the health facilities. In Windsor, we have Windsor Regional, which I'll do a lot of individuals with services that are available to make it more comprehensive and wrap around. We can't be working in silos in addiction medicine hoping to solve the problem. There has to be additional services to really make a change. The methadone, Suboxone, well documented that it does save lives if done and prescribed appropriately. But that needs to be, as I said, matched with additional resources for patients. Okay,
so how is it different when they go into one of these, I guess we can call them convenience store, pharmacies, whatever you want to refer them as, and instead of going into your place, and getting a drug? What's the difference in the way that goes in the process of why it works at, a place like Hope Recovery Clinics that you're from, or you're going to one of these clinics that is like prescribing someone, drugs over an iPad?
Great question. So right off the bat, you're going to see a live physician. I don't think that is matched in any shape or form. As much as we love virtual care, a virtual doctor sitting thousands of kilometers away is not going to provide that same level of care for the patient. Secondly, when you go to these over-the-net pharmacies, where is the drug screening? In all addiction rapid access clinics in Windsor, they are CCTV monitored. There's a staff member ensuring that this sample being provided is actually from the patient taking these prescribed medications as is. You go to these clinics, there's actually no accountability. There's no longitudinal sense of we actually made any benefit in this patient. Secondly, there's really no clinic or any pharmacy for that matter that is going to be prescribing 30 or 35 tablets of right now what is being given as hydromorphone in 8 milligram tablets. And to make a patient take one and to dispense 34 tablets makes absolutely no sense, right? So in theory, if you were to have this as a government funded organization where it is open 24 hours a day, and you're ensuring the patient is returning back and actually observing the medication that is prescribed and not taking home such an extraordinarily amount of meds, we can ensure that, you know what, we are making sure that these meds are not being put in the wrong hands, and that's not being completed. When you arrive to, let's say, my clinic, we have counselors, we have peer support workers, we have the ability to get into withdrawal management, we have the ability to enter sober living. You don't get that when you go to a virtual provider. It's literally, you might see the doctor once a month or once every 3 months, and unfortunately, as the media is saying, it's a pill mill because there's really no results and no outcomes are being met. So it's that comprehensive wraparound care that is being missed at these sort of clinics.
Yeah, well, thank you so much for your time and your insight. That is Dr. Tariq El-Sayek. He's a physician and owner of Hope Recovery, Dr. T, and he's a doctor that works in a number of our shelters as well. So we really appreciate him coming on the show this morning.
Yeah, quite the perspective he gets, right, being on the front lines and dealing with people that are suffering from addictions like this. And, well, now that we've done it along with the City of London and other cities, hopefully the province can step up and say, okay, we're going to have to regulate some of these pharmacies and shut them down or make them follow certain protocol. Yeah. To people that are dealing and dealing these drugs and getting them on the street.